Indians will now be able to create and access health records digitally. Announced by Prime Minister Narendra Modi on 27 September, the nationwide rollout of the Digital Health ID coincides with the third anniversary of the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. The scheme was initially launched across 6 states and union territories on a pilot basis on 15th of August. Over 1 lakh health IDs have already been created under the National Digital Health Mission. Under the Ayushman Bharat Digital Mission, every individual will get a unique 14-digit health ID number created using an Aadhaar card or the mobile number of the beneficiary. Electronic medical record for each individual will be created to allow doctors to track data over time and easily identify patients. This health account will consist of all details of a patient's visit to the hospital, tests, diseases, diagnosis, and much more. Records can be linked and viewed with the help of mobile applications. The Personal Health Record System linked with Arogya Setu app is a self-managed health record of an individual. The Healthcare Professionals Registry is a repository of registered medical professionals with their qualifications. The Health Facility Registry will contain information about the private and public health facilities in the country. Health-related personal information of individuals will be private and the government will ensure utmost security and confidentiality. With the consent of individuals, their personal health information will be linked to their IDs. As per the NDHM website, the Personal Health Record System will enable people to manage information about their healthcare, including lab reports, treatment details, discharge summaries, and other details. The ABDM will then create an electronic medical record where all the details will be stored. This is accessible by various health systems and domain-specific entries will be registered through the Unified Health Interface. Anyone can apply for a health ID through self-registration on the Health ID web portal, that is www.ndhm.gov.in. This can also be done by downloading the ABDM Health Records application from the Google Play Store. You can also request for creation of a health ID at any health facility, be it private or public. The registration for a health ID is voluntary and free of cost. You can either apply for a creation of health ID through your Aadhaar or mobile number. Other details required for both processes include name, year of birth, gender, and address. As per the NDHM website, the health records will be private and confidential. When you visit a health facility and provide your health ID, only then the healthcare professionals will be able to access your medical history. As per the government, the Digital Health ID will be applicable in all hospitals and healthcare facilities in the country. You can also create separate health IDs if you want the doctors to only access details relevant to the treatment. However, it is recommended to create only one health ID to establish better continuum of care.